Hello everyone. World Hearing Day, March 3rd, 2022. Do you listen to loud music all day long? Do you have shooting or bike racing as a recreational activity or any other noisy hobbies? Do you work in or own or manage a noisy factory? Are you venue managers, owners of entertainment venues like pubs, DJ clubs, music gigs, etc.? Do you have an abnormal ringing sound in ear? Are you hearing less? All these topics are dealt with in this awareness talk with regard to World Hearing Day, observed on March 3rd every year. This year, the theme is to hear for life, listen with care. It means if you want to preserve your hearing for life, you have to listen to noise with care. That is, it underlines the importance and means of hearing loss prevention through safe listening. Mainly this year, it deals with noise pollution and noise induced preventable hearing loss. So, the World Report on Hearing shows that today 1 in 5 people worldwide live with hearing loss. By 2050, it is estimated that 1 in 4 people are projected to have problem with their hearing. Nearly 80% of this population live in low income and middle income countries. And majority of these people do not realize that they have a hearing problem, or even if they realize, they do not have access to proper interventions. More than 5% of the global population, as said, lives with hearing loss, and the increase in the hearing loss is occurring due to a combination of current lifestyle and lack of awareness, and increased listening to loud sounds, which adds extra danger. What are the impacts of hearing loss? The sense of hearing, the special sense of hearing, is crucial to the development of speech. So, if a child is having a hearing impairment, inevitably the child will have a speech impairment, which will lead to difficult communication, difficult development, difficulty in education and schooling, and the cognition and understanding of the child, which in turn will affect the child's employment opportunities and development in the society. A person who is losing his hearing in the middle age or a past middle age may lose his job due to his reduction in productivity, and he will go for economic instability. A person in his or her older ages, when they lose the hearing, they won't be able to participate in the community programs. They feel socially isolated, they won't be able to communicate effectively with the family, so this in turn can lead to anxiety, irritability, decreased self-esteem. We live in a society where we are communicating all the time. So imagine a situation when you can't hear, or you are not able to understand what is being communicated to you. Noise induced hearing loss. The noise induced hearing loss can affect you through an occupational or an environmental or a recreational setting. So, coming to a little bit of basic, sound is an energy and it travels in waves. So, it can be measured in two ways, by frequency and amplitude. Frequency is usually measured in hertz, and it refers to the pitch, that is high or low pitched sound. Human ear can detect frequencies from 20 to 20,000 hertz. The main topic in main topic that I'll be talking about here, it will be amplitude. That is the decibel scale. It measures the sound pressure or forcefulness. The more amplitude a sound has, the louder it is. What is hazardous noise? A noise is considered loud or hazardous when it reaches 85 decibels or higher, or if two people are sitting and talking, and we are considering that both their hearings are normal, and that one person has to raise his or her voice to speak with someone 3 feet away at an arm's length. They have to raise their voice. That means they are at a hazardous noisy environment. What is unsafe listening? See, this chart shows the different sound levels for different activities. So normal breathing is around 10 dB. The soft whispering is 30 decibel. Normal conversation is 60 decibel. A doorbell is 80 decibel. So 80 decibel is a higher value. So this shows approximate sound level in decibel and maximum permissible time per week for safe listening. So you can listen unlimitedly, soft whispering, normal conversation and all, you can listen unlimitedly. But when it comes about 80 decibel, 85 decibel, the time for which you can listen for a week reduces. See, a motorcycle is 95 decibel. A hair dryer is 100 decibel. So you can listen only for 20 minutes a week for a hair, with the hair dryer. Then car horn shouting in the ear all comes above 100 decibels, and the airplane taking off, it is 140 decibel. You are not supposed to hear the airplane taking off sound without any protective equipment. These are some other average home noises comes around 40 decibels. Then subway shouted conversation can come around 95 to 100 decibels. Gunshot or siren, nearby siren, it comes around 140 decibels. So, what is safe listening? Listening to sounds at 80 decibel for 40 hours a week is the limit of safe listening. It is always better to listen less, but you have no other option but to expose yourself to sound. Means the maximum you can listen is listen at 80 decibel is for 40 hours per week. That is daily if you're listening, not more than 5 hours. So, in a relaxed conversation, usually we can understand speech in 35 and background level of 45 decibel hearing. And if you can put some more vocal effort, the speech can be understood at a sound pressure level of about 65 decibel also. So, the permissible time for safe listening decreases as the sound level increase. So, if the sound in music clubs and concerts, sometimes it becomes as high as 110 decibels, and some headphones also play equally high sound. So, even a short duration of exposure to such high decibels can be harmful. Habitual exposure over time will certainly lead to hearing problems. How does loud sound affect hearing? Exposure to loud sounds of any length of time will affect the sensory cells of the ear. That is outer hair cells and then the inner hair cells. It usually starts beginning at the basal turn of cochlea. There are two types. One is temporary threshold shift. In this, you get lucky. You go to a concert or you go to an action thriller movie with lot of sound and sound effects, and afterwards you can experience some muffled hearing or ringing or buzzing in ears, which get better within 24 hours or a few days time. This often improves. It causes fatigue of the sensory cells and it improves. That is temporary threshold shift. Permanent threshold shift with regular exposure, continuous exposure, loud prolonged exposure. The sensory cell damage is permanent and irreversible hearing loss will be there. These people will have a continuous ringing in their ears known as tinnitus. So, what is acoustic trauma? That is a different entity. That is a single brief exposure to a very intense sound, such as an explosion, gunfire, or a powerful cracker, can result in permanent damage to hearing. Sudden loud sound has the potential to damage the outer hair cells, the organ of corti, Reisner's membrane, tympanic membrane, and even the ossicular chain. So, this that causes acoustic trauma. So, noise level in a gunfire or a rifle gun may reach up to 140 to 170 decibels. There are other effects for noise. So, noise, electrophysiological and behavioral methods have showed that if you are exposed to constant noise from morning to night, 24 hours, you are exposed to noise, it can affect your sleep levels. It reduces the proportion of REM sleep, and it also has difficulty in falling asleep. And sleep quality reduces, and even when you wake up, you will have headache, tiredness, and not refreshing sleep. So a lot of people come to the OPD with all these complaints, and if any of you are suffering from conditions like this, like some sound in the ear, not able to hear properly, irritability, be sure that you are not exposed to more noise. Factors affecting the noise trauma. The frequency is the most important factor. A noise of 2000 to 3000 hertz frequencies cause more sensory neuron hearing loss. Intensity and duration. So, as the intensity of noise increases, the permissible time for exposure is reduced. The 5 dB rule of time intensity. That any rise of 5 dB noise level will reduce the permitted noise exposure time to half. That is, you can listen with 85 dB for 40 hours. Means if it increases by 5 dB, like it becomes 90 dB, you can listen only for 20 hours. Then people are genetically susceptible to get more noise trauma. If people have pre-existing ear disease, they can have more noise trauma. And continuous sound, like continuous exposure to sound, causes more damage. Occupational hearing loss. Occupational hearing loss also follows all the same things. When the sound is reaches 85 dB or higher, it causes occupational hearing loss. Another thing that affects in occupation is using of autotoxic chemicals. So what happens is that the both effects in a factory where there is sound and autotoxic chemicals, there is combined effect. Chemicals that include solvents, metals and compounds, mercury compounds, carbon monoxide, nitrile, some certain anti-neoplastic agents. Coming to the topic of the day. Today's theme is safe listening. So noise induced hearing loss is irreversible. Once it happens, it happened. But the good news is that it can be prevented through safe listening practices. What is safe listening? Keeping the volume down. Listen when you're listening to personal audio systems, smartphones, or MP3 players, always keep at a volume level below 60% of maximum and use carefully fitted noise cancelling headphones. Limiting the time spent engaged in noisy activities. Monitoring listening levels. Many devices such as smartphones and listening software, they have built-in safety measures, volume limiting and sound level monitoring. There are apps such as Hear Angel, DB Track, Hearing Health app that is included in some smartphones. It can be used for the purpose in addition to keeping track of the sound consumed, and it will alert the listener if the recommended limit is exceeded. Protecting the ears from loud sounds. We can use wearing personal protective equipments in noisy venues. Moving away from source of sound, such as loudspeakers. You are in a marriage hall and lot of music and dancing and everything is going on. Don't sit near the loudspeaker. Sit away from it. There are different kinds of ear protective equipments. Ear plugs, those are inserted into the canal. They can be pre-molded, moldable, foam, custom molded, etc. Semi-insert ear plugs, which consists of two ear plugs held over the ends of the ear canal by a rigid headband. Ear muffs also is there. It is sound attenuating material and soft ear cushions that fit around the ear and hard outer cups. Recommended upper sound limit. There should be a recommended upper sound limit for societal cultural activities, like ongoing monitoring of sound levels in venues and events, optimization of the venue acoustics, and using good sound system designs. Then provision of the hearing protection free of charge to audience and members upon request. Access to respite areas where attendees can rest their ears from loud sound. And accessible information has to be given to the audience. Like in cigarette packs, it is written, no, cigarette smoking is injurious to health. Similarly, the warning should be given. Exposure to this loud sound is injurious to the health, so that the awareness is there and they can have safe listening measures at the venue. Warning signs of hearing loss should not be ignored. Do not ignore early signs. Maybe some sound in the ear, you are not able to hear high pitched sounds like doorbells, or you are missing your alarm clocks, difficulty in understanding speech, especially over telephone, you have to concentrate more or you're asking again and again, and following conversations in noisy environments in restaurants or railway station is difficult for you. All these signs are early damage. All these signs are early signs and you have to get it checked. Permissible noise level in India. There is Central Pollution Control Board. It has set up permissible noise levels in India. In industrial areas, the permissible limit is 75 dB for daytime and 70 dB at night. Commercial areas, it is 65 and 55. In residential areas, 55 dB for day, 45 dB at night. Apart from this, there are silent zones like schools, colleges, hospital, courts. There it is 50 dB and 40 dB. I don't think this is followed very meticulously in most of the areas. Previously, I used to see no horn, no sound boards in front of schools and hospitals, but now it is not seen, and the traffic is too much. And mostly, the traffic occurs in the hospital entrance, school entrance areas, and the noise is beyond 85 dB or 90 dB. And there are regulation. There is noise pollution regulation control rules. At present, violation of noise pollution rules is a criminal offence, punishable under Section 15 of the Environment Protection Act 1986, which could attract imprisonment up to 5 years and fine up to 1 lakh. So be aware of all these things, and do not be reluctant to approach authority if you find noise pollution anywhere, and be socially and personally responsible citizens. For occupational prevention, all this above methods are applicable. Apart from that, they should be given official break from noise activity, and the equipment should be well maintained and lubricated so that it will be quiet. And you can enclose the source of the noise, or a place and a barrier between you and the source. Increase the distance between you and the source of the noise. Then always wear hearing protection in noisy areas. Like most of the places, they will be giving hearing protection, but it is like COVID and mask issue. Mask, everybody is advised to wear mask, but nobody wears it. Same thing happens with ear protective equipments also. Everybody advises to wear, but nobody wears it, and finally the employees or the personnel end up losing their hearing. Then persons who work in the factories where the noise is above 85 dB should have pre-employment and then annual audiograms for early detection. Using of this plug or ear protectors provides protection up to 35 dB. Then they also can take measures to reduce or stop exposure to chemicals that may damage the hearing. Wear gloves, long sleeves, eye protection, wear respirator, change to a less toxic chemical, etc. Be aware that there is this silent epidemic, that is a permanent hearing loss. Some youngsters think that hearing loss occurs only to older people. No, WHO estimates that 1 in 2 young person, that is below 12 to 35 years of age, are at risk of hearing damage from listening to loud music on their devices, and 40% are exposed to unsafe levels in venues. There are 430 million people currently living with disabling hearing loss. 1 billion people are aged between 12 to 35 years. Most of this issue in young people are that small subtle symptoms will be there, but they won't take it seriously, and it do not manifest immediately. Once the problem become apparent, it is usually too late. The truth is that listening to sound that is too loud or too long, it can trigger a problem, and that and the hearing may not come back to you. Don't let the hearing loss limit you. Last and not the least, if you get a hearing loss, don't let it limit you. Seek help immediately. We have lot of provisions and help in children. Immediate treatment is needed so that their speech is developed properly and they can continue with their day-to-day activities. In elderly people, we have hearing aids, rehabilitation therapy, speech support, and counseling for the attenders. Everything is needed so that early intervention should be made available, and we are these people, and people with the hearing loss are protected adequately. Public health measures, it can prevent hearing loss caused by noise and loud sound. As I told today, we can avoid that. Then birth complications, immediately diagnosed and treated. Otitis media should be diagnosed and treated. Like if you are child or if you are having a ear infection, immediately go to the doctor. There are vaccine preventable diseases such as meningitis due to H influenza B and B causes hearing loss, that is preventable. Then there can be monitoring the use of ototoxic medicines and chemicals. At every stage in life, hearing loss can be addressed through systematic screening. And we have to identify hearing loss early in newborn babies and infants, preschool and school age children. In people exposed to noise or chemicals at work, they need annual or every 6 month checkup. People receiving ototoxic medicine require regular follow up, and older adults. So, universal access. Universal access to quality ear and hearing is possible through hearing screening and intervention. Prevention is always better than cure. So, we have to screen hearing, newborns, and as explained earlier, and ear disease prevention and management, access to technologies. In many places, hearing is not given that much importance as any other disease. Also, patients or the person who is having a hearing loss also ignores it because they think that it is not affecting their life, but it is affecting their life without even their knowledge. So they should be made aware of the situation, and access to technologies has to be provided by the government, the health sector, the NGOs, public and private sectors. Rehabilitation services, improved communication, noise reduction. As explained today, the topic of this year is noise reduction and safe listening and preserve your hearing. Greater community engagement, like encouraging people with hearing loss to do activities, not ignoring them, allowing them to participate in community gathering and encouraging them. So we know that noise is bad. Noise causes hearing impairment, it can cause annoyance, mental impairment, speech intelligibility, disturbance of information extraction, sleep disturbance. And in certain reports, it can lead to hypertension, cardiac disease, and long term exposure to noise. So, summarizing, it is possible to have good hearing across the life course through ear and hearing care. Many common causes of hearing loss can be prevented, including hearing loss caused by exposure to loud sounds. Safe listening can mitigate the risk of hearing loss associated with recreational sound exposure. Hearing health and rehabilitation is an urgent and essential priority. It will improve the health and well being of people everywhere and help us achieve Sustainable Development Goal 3 and ultimately a world in which no one, no child, no adolescent, no adult is left behind. Let us listen safely and hear each other longer. These are my references. Hope this video made you more aware and your hearing safer. Thank you.